How's it going?
Good, good. We have a very interesting case today. It's a 2-day back-to-back FUE. Trying to get 2,000 grafts from scalp and put it on the hairline, front, and temples. Today, we're going to go after the beard area and try to remove 1,500 grafts to support the top and a little bit of the crown area. So this is a gentleman who had 4 procedures before. So everything is front is probably transplanted. Not here, but somewhere else. Tune the hairline, make it a little more irregular, give him a widow's peak here, reinforce the temples. The temple area, we're going to do it on both sides. We're going to reinforce the hairline, we're going to reinforce the whole front, and then we will reinforce the whole front and go all the way here for the first day. When he comes back, we're going to put 1,000 grafts here, probably 500 on the crown area in the back. This is the crown. He has a big balding patch on the crown that we're only putting 500 crown with beard to scalp hair transplant. The patient wanted to be presentable just in 1 week after procedure, so we decided to do layer shaving. Shaving is a good method for most people, but for him it's a little bit tricky because he has a lot of scars on the back. Unfortunately, what should be done, they've done multiple scars on the back. They perform multiple surgeries. One of them gave him one separate scar, so he had multiple levels of scar, something like this on the back. They're all wide and they're all very noticeable. To keep his hair long, so we're doing layer shaving, but there's not much room that we can move around the scars. So we're giving him topic in case there's some visibility in the back after layer shaving. He can use topic after procedure.
So it's in the widow's peak now. So we need to reinforce widow's peak. We already did the temples on both sides. And the other side, we can make sides. The widow's peak needs to be reinforced, and we regularized the hairline. He had some previous hair transplants that gave him grafts with 2 hairs in front of hairline. We're trying to recreate the hairline. Singles in front of those islands of singles in terms of like spikes that will easily cover those flaws. It's a hairline that will not be even detectable by a hairstylist.
11, 12, 13, 14, 15, 16, 17.
Camera girl. What's happening? Between 3 different strip scar and FUE scars, easy to find a good pocket to remove hair, but it helps him with the visibility of the scar when we reduce the contrast. So the hair was finer at the bottom, so we used some of those for the top areas, and the top areas that hair quality is better, we use it for temples, frontal hairline. So that guarantees that he has a better solid hair in the front and in the back. He has hair, but maybe not as tough. This is a 2-day procedure. This is day 1. I've added 2 days. Tomorrow is going to come back for beard to scalp hair transplant to cover some areas. And crown. The good news is he has great quality beard, and we're going to use those for the other areas that we don't have enough hair in the back.
And kind of focus on a little bit more.
A beard hair transplant to the scalp area. Yesterday, this patient had another procedure from scalp to scalp for the front and temples. Today, we're going to use beard hair from the bottom of the chin area to put in the top area, a little bit of the front of the crown. So we're going to show you how to extract beard hair and how to transplant it, and what are the problems that we may have. Beard area, different quality hair, thicker hair, coarser hair, more single hairs as opposed to 2s and 3s. I'm working closely with my assistant. She keeps removing them and giving me the guidance of how I have to their feedback. We keep changing the angle until we get it right, and in this case we already have it, so the rest is going to be nice and easy. A lot of hairs are singles on the beard area. We may have 2s and 3s sometimes, and that's a good replacement for hair for many men, especially men who don't have enough supply of scalp hair to be transplanted.
So we're done with the FUE of more than 1700 grafts from the beard area to the top of the scalp. Hair is a great source of hair for people who don't have enough donor hair on the scalp. Who go toward higher stages of hair loss, and there is a donor recipient mismatch. This patient had multiple hair transplant procedures through strip methods and FUE in past, but he couldn't get a full coverage, so we had to use beard. Let's look at these pictures and see what we did. This is the scalp. We covered this top section today with some extension to the back because it's going from side to side. I thought more density here will help him to the other side. For the donor area, we removed it from both sides of the neck. So this is the picture of the neck area. You see on both sides we remove hair. The middle we didn't have to, we kept it for the future, and that gives us more than 1700 grafts. This is from different angles, from right and left. That's how it looks right after procedure. In a day or two, you don't see much. So the recovery is very fast with beard transplant from the donor area. And this is the areas, the front widow's peak that we did from yesterday and today. So this is the area that we focused today. The top area we put maximum density here, and a little bit in the front that we made sites from yesterday. Our FUE beard to scalp procedure was done easily, successfully, and he should expect a very good result. For today, this is Dr. Mohebi from Parsa Mohebi Hair Restoration, wishing you a happy hair day.